my name is Dr. Manali. I'm a physical therapist over here at Legacy Physical Therapy. So I just want to take a little bit to talk to you about painful periods. The medical term for that is called dysmenorrhea. But this is something that over 80% of women are going to be affected by at some point in their lifetime. I mean, it is so common for people to be like, oh, I have a lot of pain with my periods. I'm going to go pop an ibuprofen. And that is something that I want to educate you guys on to maybe try some other types of techniques and methods that will decrease some of that discomfort without turning to those ibuprofen pills. So basically, just to kind of start off with, menstrual cramps occur because of this chemical. It's called prostaglandin. So prostaglandins are naturally present in the body. They're really big. One of their roles is to contract and relax the uterus, but during the periods, prostaglandin is released for that uterus to contract in order for that endometrial lining, the bleeding, to detach and flow out of the body. However, when there's a lot of that prostaglandin release, that's when the uterus kind of tends to over contract, and that's when you get a lot of that cramping sensation in the muscles that kind of surround the uterus. So there's actually two different kinds of dysmenorrhea, or two different kinds of painful period categories. So the first one's called primary. So primary is the ones that we get kind of early on, typically on the first day of periods, and so that's where there's a lot of kind of discomfort, cramping in the abdomen, the back, the thighs, and then the second type is called secondary dysmenorrhea, or secondary kind of painful periods, and that's when it's coming more from something like endometriosis, fibroids, things like that, there's a condition present that's contributing to those symptoms. So there are 5 ways that I have come up with for you to reduce some of the pain that is no medications. So the first one is massage. So what you can do is just perform a gentle, just kind of massage around the abdomen, the pelvis, and what that can do is it just relaxes that tissue just to contribute just some, stop some of those restrictions that are there that can decrease the cramping and bloating that you're experiencing. The second tip is exercise. So exercise, studies show that exercising regularly decreases the amount of menstrual pain and cramping that people experience. This exercising can be running, walking, just gentle stretching, things like that. One of the things that exercising does is it releases this hormone called endorphins. And so what that does is it blocks some of those pain receptors that naturally get to the brain. So instead of reaching for that ibuprofen, do some stretches. The third tip that I have for you is maybe trying some kinesio tape, K-tape. And what you can do is you can just gently apply that tape. It can be across the abdomen, pulling that tissue and that skin up off of the pelvic area, because that can just improve some of that blood flow, some of that oxygen that's getting to that area. And so that's tip number 4. Tip number 4, actually that's tip number 3, sorry. Tip number 4 is using a heating pad just on the abdomen, the low back. That can really help improve some of your blood circulation and relax some of those tight muscles that you've been having. Tip number 5 is using something called a TENS unit. So this is something that you can get off of Amazon. But what it basically does is there's going to be 2 to 4 kind of patches that you can apply at different places. It can be on the lower back area, it can be on the thighs, but what it does is it also sends pulses kind of through the skin to your nerves to block some of those pain that you're experiencing. And so those are my 5 quick tips for reducing some of those pain during your period. So number 1, massage. Number 2, get exercise in. Number 3, try some kinesio tape. Number 4, try a heating pad. Number 5 is try out a TENS unit. So yeah, those are my 5 tips for reducing some of that pain you're experiencing during your periods. Again, if you have any questions about anything or want to come see us to deal with some of that pain, come on over to Legacy Physical Therapy. My name is Dr. Manali. Bye.